So who's a candidate for a penile implant? Well, there's an algorithm that I follow for all men that are having erectile dysfunction. First, we try the medicines like Cialis, Viagra, Stendra. If those don't work, then I move on to injection therapy. So we'll bring a guy in the office, we'll do ultrasounds, we'll inject a medicine into the side of the penis, and that almost always works. But if the medicine is cumbersome, difficult to inject, painful, awkward, in other words, when you're trying to get in the moment and you're like, excuse me, I gotta inject something, then we have to start thinking about a penile implant. So for the most part, insurances will cover penile implants. Medicare does. Some of the privates do, such as Blue Cross, Aetna, Cigna. But within those private carriers, there are little subsections that they may not cover a penile implant. Fortunately, it can be paid for. There are ways of getting things handled. A common question is, what type of implants are available? So there's basically two types of implants. One is a malleable, and one is what we describe as a three-piece or an inflatable penile implant. So what's the difference between a malleable and an inflatable penile implant? A malleable is a rod-like system that's bendable and very easy to put in. It does have a lower risk factor, but it's kind of always up. You always have a chubby. You put it up, you put it down. You put it up, you put it down. Whereas an inflatable, which is also known as a three-piece, that's a little bit more complicated, but it has the highest success rate and the highest satisfactory rate. And this is a series of cylinders that go in the penis, a reservoir, or like a little bag of water, a balloon, that goes next to your bladder, and a pump with a release valve that goes in the sac right in front of the testicles. And so when you're ready to have sex, you say, pardon me, and you pump it up. Pump, 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 and up it goes. And then when you're done, you say, I'm done. You hit the release valve, it goes down, and you say, I'm done. So after surgery and the recovery phase, there's usually a few weeks before you can actually operate the pump. But once you're all healed up and everything's good to go, it's time to turn on the device. So a device looks like this, all right? So you have the reservoir, you have the cylinders, and then this is the pump. And so when you're ready to have a hot date, you say, pardon me, and you start activating the device. And you may actually hear this gushing sound. And when you're done and it's all inflated, you have your hot moment. When you're done, you just use the little release valve, squeeze it, and it pushes the fluid back into the reservoir, and then you can go and take your nap. So after an implant is performed, a very common question is will my ejaculation and will the sensation be the same? And the answer is a little complicated. As far as sensation goes, it should be exactly the same because we're not disrupting any of the nerves that are affecting the skin of the penis. Now, when it comes to ejaculation, it depends on the individual. If a man has already had prostate cancer surgery and he can no longer ejaculate, or BPH surgery or radiation, unfortunately, we're not going to make that ejaculation better. But they still should be able to climax, and climax is a little different than ejaculation. If a man still has all of his body parts, the prostate and the seminal vesicles, and they have not been disrupted by previous treatment, then yes, ejaculation should be exactly the same. So for the two types of implants, the malleable is not really that concealable. Now, if a man is just standing there and you look at him, you won't tell the difference in the sense of seeing something, but like I mentioned in a previous video, he always has an erection. He always has a chubby. Whereas with the implant, the three-piece, the inflatable prosthetic, that looks very natural. And so when you see a guy, or if you're looking at yourself in the mirror and it is not inflated, it looks completely natural. And when it's deflated, once again, completely natural looking. The three-piece implant is made of Bioflex. This is a medical grade material unique for the penile implant. The solution inside the three-piece inflatable implant is sterile saline, which is basically just sterile salt water. So the procedure to put in a three-piece inflatable implant is an outpatient surgery. And so the way we do it is a small incision, about roughly 1.5 inches, maybe 2 inches, just above the penis is made. Obviously you're under anesthesia. We use lots of numbing medicine. We numb up everything we can think of so that when you wake up, you are numbed out. The inside of the penis is open. These are called the corpora, and the cylinders are put inside. We then place the reservoir inside next to the bladder, and then the pump goes inside the scrotum. Many times a patient will wake up with a drain coming out, and that's just because unfortunately surgeries are bloody and we want to get the blood away from the surgical site, and most commonly that drain is removed 2 days later. The recovery for an implant varies, but what I usually tell guys is that they're going to be good and numb for the first 24 hours, hopefully with the numbing medicine. Some guys less, some guys more. When they go home, their job is to catch up on Netflix, ice pack, and take antibiotics, all right? And of course, pain medicine will be available for you. Usually around post-op day number 2, you're going to come on in, and we're just going to take the little drain out, and that's the drain that keeps the blood away from the surgical site. And then you go home and you continue icing it, taking your antibiotics, and taking your pain medicine. Usually by 7 to 10 days, guys are pain-free, all right? Maybe they're taking a little Tylenol, a little Motrin, but usually they're off taking the pain medicine. Some guys are not, but most of them are. The swelling that's going to happen in everybody is going to start to pick up around day 2 and 3 from the surgery, and that tends to start to go away roughly around 2 to 3 weeks afterwards. And then, once the swelling is gone, then we bring you in roughly anywhere between 3 weeks and 6 weeks, and that's when we teach you how to turn on the implant and pump it up. We try to teach men how to use the implant anywhere between 3 and 6 weeks after the procedure. Some guys heal quickly, some guys take their time, but that's usually the time frame of when we can have a gentleman come in, learn how to activate the pump, learn how to deflate the pump, and that way they can feel comfortable using it at home. So there's actual research on how long a penile implant will last, and the statistics are that 88% of men will have a functioning penile implant after 10 years, which is wonderful. In other words, you have your surgery and you should be good for 10 years, 88% of the time. Certainly for the 12%, if it stops working because it is a mechanical device, we will have to replace it for you, or even after 10 years, it can be replaced. What are the satisfactory rates for a penile implant? Well, of course I want to say 100%, but unfortunately in medicine's nothing 100%. But there's actual research on this, and it shows that for men, the satisfactory rate's well into the 90% range, and for the spouses, it's even higher. Let's face it, when you have a man or a couple that is not sexually active, and you allow them to have sex for the first time, you're going to have a happy customer, and they're going to come back to you smiling from ear to ear. So even though we love doing penile implant surgery here at Advanced Urology, there are risks involved, and the risks are serious. You need to know about them. Fortunately, the risks are low. The biggest risk is infection. So with time, with research, with improving techniques, we've actually gotten this risk down dramatically over the last 10 to 20 years. Men with diabetes, men with a history of smoking, those risks are going to be a little bit higher than if they don't have diabetes or if they don't smoke. The other risk is that it's a mechanical device. It wants to break. It's just like your computer, it's like your car, it's like your toaster oven. It's going to try to break down on you. Fortunately, it can be replaced. Take it out, wash the insides, put it back in. A rare risk is what we call erosion. Erosion is where the mechanical parts of it try to break through the skin and come out. Fortunately, That's very low in risk, and the reason for that is because when we do the surgery, we measure the size of the implant that we want to put in. We don't want to oversize things, we don't want to undersize things, we want to get it just right.